pain during intimacy is something that many people feel, but very few talk about openly. If you've ever wondered why it happens or felt unsure about bringing it up, you're not alone. It's a real issue that affects both physical and emotional well-being, and ignoring it can make the problem worse over time. What many don't realize is that discomfort in this area isn't always just a physical problem. It can be a reflection of lifestyle choices, stress levels, hormonal changes, or even undiagnosed health conditions that build up silently over time. Men often face their own unique set of challenges too. They may experience pressure to always perform, to stay strong, or to never show discomfort. And this mindset can make them less likely to seek help when something doesn't feel right. Over time, this can lead to frustration, distance in relationships, and even impact overall health. Recognizing that both men and women can be affected differently by physical pain and emotional stress is the first step toward addressing it properly. Taking care of your health holistically is essential. This means maintaining a balanced lifestyle that supports your body and mind. Regular exercise improves blood flow and hormone balance. A nutritious diet keeps your energy steady. Good sleep allows your body to repair, and managing stress reduces tension that can contribute to discomfort. Open communication with your partner and your healthcare provider is just as important. When these elements come together, not only does physical comfort improve, but confidence, connection, and overall well-being rise too. In today's video, we're going to break this down clearly and practically. We'll talk about the common reasons discomfort happens, how lifestyle plays a bigger role than most people think, and what simple, actionable steps you can take to improve your health and your quality of life. This conversation is about knowledge, empowerment, and taking care of yourself fully. Many people tend to brush off discomfort during intimacy as something temporary or insignificant. But in reality, it's often the body's way of sending an important message. Pain is not something that appears without reason. It is a signal that something deeper might be happening, whether physically, emotionally, or hormonally. Unfortunately, because topics related to intimacy are still surrounded by discomfort or stigma in many cultures, people often choose silence over seeking solutions. This silence can lead to months or even years of suffering, frustration, and misunderstanding, both within oneself and in relationships. The body has a way of communicating when something isn't right, and discomfort is one of the clearest indicators that attention is needed. When these signals are ignored, minor issues can turn into more serious health concerns over time. For many individuals, pain may begin subtly, a slight discomfort that seems easy to dismiss. It might happen occasionally and not seem like a major issue at first. However, over time, if left unaddressed, this discomfort can increase in frequency and intensity. What starts as mild sensitivity can evolve into persistent pain that affects not only physical well-being, but emotional confidence and relationship dynamics too. Pain can cause individuals to avoid intimate moments, feel anxious about future experiences, or blame themselves for something that is actually a medical or lifestyle-related issue. This emotional toll is often underestimated, yet it plays a huge role in how a person perceives their health and self-worth. Ignoring these early signs doesn't make them go away. In fact, it often leads to a cycle where the anticipation of discomfort makes the experience even more stressful. One of the biggest challenges is that many people simply don't know when pain is considered abnormal. There's a tendency to normalize discomfort, assuming that it's just part of life or something that happens to everyone. This is especially common when people don't have open conversations with trusted individuals or healthcare providers. Without proper information, many accept discomfort as inevitable rather than treatable. But the truth is, most cases of pain during intimacy have underlying causes that can be identified and managed when addressed early. These causes can range from hormonal changes and infections to lifestyle factors like chronic stress, poor sleep, or lack of proper self-care. The key is recognizing that pain is not something to adapt to. It's something to understand and respond to with care and attention. Another important aspect is the emotional and relational impact of ignoring pain. When someone experiences discomfort but doesn't talk about it, their partner might misinterpret the situation. They might think the lack of engagement is personal, leading to feelings of rejection, guilt, or confusion. This misunderstanding can quietly create distance between partners over time. On the other hand, the person experiencing pain may carry feelings of shame, embarrassment, or fear of being judged. This emotional burden can make them retreat further, making it even harder to seek support. What begins as a physical issue can slowly shape the emotional foundation of a relationship if not addressed. Recognizing the importance of open, honest communication is a vital part of resolving discomfort and preventing unnecessary emotional strain. Listening to the body is a skill that many people overlook. Modern life often pushes us to prioritize work, responsibilities, and external demands over our own physical well-being. In that rush, we ignore subtle signs until they become impossible to overlook. But the body rarely stays silent when something is wrong. Discomfort, especially during something as personal as intimacy, is rarely random. It can reflect issues like inflammation, infections, hormonal fluctuations, or even emotional stress manifesting physically. By paying close attention to when the pain happens, how often it occurs, and what factors might influence it, individuals can gain valuable clues about what their bodies are trying to communicate. These observations can make a significant difference when discussing symptoms with a healthcare professional, leading to faster and more accurate solutions. It's also essential to remove the fear associated with seeking help. Many people hesitate to talk to their doctors because they think the issue might not be serious enough, or they feel uncomfortable bringing up such personal matters. However, medical professionals are trained to handle these situations with sensitivity and confidentiality. Addressing pain early often leads to simple solutions, such as lifestyle adjustments, targeted treatments, or stress management techniques. Waiting too long can make the treatment process more complicated and extend the emotional burden unnecessarily. Taking the first step toward acknowledging and discussing discomfort is often the hardest part, but it's also the most empowering. Pain is the body's built-in alarm system. Just as we wouldn't ignore a car's warning light, we shouldn't ignore the body's signals either. Dismissing pain doesn't make it disappear. It allows the underlying issue to continue, often in silence. But when we approach discomfort with curiosity instead of fear, with openness instead of avoidance, we give ourselves the chance to find real, lasting solutions. Each person's experience is unique, and so is the reason behind their pain. Some may find that stress reduction and lifestyle changes make a significant difference, while others may require medical evaluation and targeted care. The common thread is that pain is meaningful, and it deserves attention rather than avoidance. Taking a proactive approach doesn't just improve physical health, it builds confidence and emotional well-being too. When individuals learn to trust their bodies, listen to their signals, and respond thoughtfully, they create a healthier relationship with themselves. This confidence often reflects in other areas of life, from relationships to overall mental clarity and self-assurance. Ignoring discomfort keeps people stuck in uncertainty, but addressing it opens the door to knowledge, relief, and improved quality of life. Acknowledging that pain is a signal, not a life sentence, is the beginning of real change. It's about shifting from silent endurance to active care, which ultimately leads to healthier, more empowered living. Men and women experience physical discomfort in very different ways, both in how their bodies respond and in how they emotionally process those experiences. Understanding these differences is important because it helps us see that pain or discomfort is not a one-size-fits-all issue. For many women, hormonal fluctuations, stress, and even emotional strain can create sensitivity that affects their overall well-being. For men, the pressures often come from a different angle. There's a cultural expectation that men must always be physically strong, emotionally unaffected, and able to perform without showing vulnerability. This silent expectation can become a heavy burden, making it difficult for men to acknowledge when something doesn't feel right. Instead of seeking help or talking openly, many choose to internalize their discomfort, which can lead to deeper problems over time. Both men and women face unique health challenges that, if ignored, can impact their physical and emotional connection, making honest conversations even more essential. For women, hormonal changes can influence not only their cycles, but also their physical comfort in intimate situations. Shifts in hormone levels due to age, stress, or underlying health conditions can lead to changes in tissue elasticity, natural lubrication, and sensitivity. These changes can make previously normal experiences feel different or even uncomfortable. When women are under chronic stress, their bodies may respond by redirecting energy away from reproductive or intimate functions toward basic survival systems, leading to increased dryness, tension, or sensitivity. These changes are biological responses, not personal flaws, but without understanding this connection, many women may blame themselves or feel confused about why their bodies suddenly react differently. Emotional stress compounds this because the mind and body are closely connected. Worry, anxiety, or emotional exhaustion can translate physically, creating discomfort where there once was ease. Men often face a different but equally challenging situation. Social pressures teach many men to stay silent about pain or discomfort, especially in intimate contexts. Admitting to discomfort can be mistakenly viewed as a sign of weakness, leading many to suppress their concerns. This silence doesn't make the problem disappear, it can make it worse. Physical discomfort might manifest as tension, performance issues, or even emotional withdrawal. But because it's rarely discussed, it remains hidden beneath the surface. Over time, this can create misunderstandings in relationships, with partners misinterpreting silence as disinterest rather than discomfort. Men may also experience hormonal changes as they age, such as lower testosterone levels, which can affect energy, mood, and physical sensations. These changes happen gradually, and because they aren't openly discussed, many men don't realize that their experiences are valid and common. Beyond the physical differences, emotional responses to pain also vary. Women may be more likely to talk about their discomfort with trusted friends or healthcare providers, but they may still hesitate due to embarrassment or fear of judgment. Men, on the other hand, often feel pressure to tough it out, keeping everything inside. Both approaches can prevent people from getting the help they need. Emotional suppression, whether it's silence or avoidance, can amplify discomfort over time because stress hormones remain elevated, affecting the body's natural balance. Emotional well-being is deeply tied to physical sensations, and ignoring either side creates an imbalance that eventually shows up in some form of discomfort. Relationships are another area where these differences become especially clear. When one partner experiences discomfort but doesn't communicate it, the other may misinterpret what's happening. They might think they're being rejected or that the relationship is losing its spark, when in reality, the issue is physical or emotional discomfort that hasn't been shared. For couples, this lack of communication can quietly create emotional distance. What begins as a health issue slowly transforms into relational tension, not because either partner intends it, but because the real issue remains unspoken. On the other hand, when both partners are willing to talk openly and without blame, they can work together to find solutions. Recognizing that both men and women face unique challenges creates a foundation of empathy and understanding that makes these conversations easier. Addressing these differences starts with awareness. Many people simply don't know how much factors like stress, age, hormones, or emotional strain influence physical comfort. By understanding that these are common and natural aspects of health, individuals can let go of self-blame and focus on solutions. For example, women who understand that stress affects their physical comfort can focus on relaxation techniques, better sleep, or lifestyle changes that support hormonal balance. Men who recognize the impact of social pressure may feel more empowered to talk openly with their partners or seek professional guidance without feeling shame. Education and awareness break down the silence that allows these issues to grow unnoticed. Healthcare also plays an important role. Unfortunately, many people delay medical consultations because they assume discomfort is temporary or too personal to bring up. But when both men and women understand that their experiences are valid and shared by many others, seeking help becomes less intimidating. A healthcare provider can identify underlying issues, whether they're hormonal, psychological, or related to lifestyle habits. Early intervention often leads to simpler, faster solutions than waiting until the discomfort becomes severe. By addressing these challenges proactively, individuals not only improve their physical health, but also strengthen their emotional resilience. Cultural and social norms also need to be acknowledged. In many communities, discussions around intimate health are still considered taboo, which discourages people from sharing their experiences or seeking help. This silence affects both genders differently, but with similar outcomes: unresolved discomfort and emotional strain. Creating an environment where such conversations are normalized, respectful, and informative allows both men and women to better understand their bodies and their partners. It shifts the mindset from shame to empowerment, from silence to solutions. When both men and women acknowledge their unique health challenges, a space opens up for compassion and cooperation. Instead of seeing discomfort as an isolated or personal failing, they begin to see it as a shared human experience that can be addressed with understanding, lifestyle changes, and professional support. These differences are not barriers, they're opportunities to build stronger communication and healthier lives. Recognizing that men and women face different challenges doesn't divide people. It brings them closer by creating mutual respect and clarity. In the end, both physical and emotional health benefit when individuals stop ignoring these differences and start addressing them openly, thoughtfully, and with care. Lifestyle choices play a far bigger role in physical comfort and overall well-being than most people realize. Many individuals focus only on symptoms when something feels off, but often the root of discomfort lies in everyday habits: what we eat, how we move, how we sleep, and how we handle stress. These factors work together to shape how the body functions, including how it responds to sensations, hormones, and emotional states. When these foundational elements are out of balance, discomfort can surface in subtle ways at first, and then become more noticeable over time. The good news is that by adjusting lifestyle patterns, many people experience meaningful improvements in their physical comfort, energy levels, and emotional resilience. Small, consistent changes can have powerful effects that build over time, creating a healthier and more balanced body. Stress is one of the most significant lifestyle factors that influence physical well-being. When the body is under chronic stress, it releases hormones like cortisol that prepare the body for survival, not relaxation. This redirection of energy affects many systems, including those responsible for comfort and sensitivity. Muscles tighten, circulation changes, and hormone levels shift, which can all contribute to discomfort. Prolonged stress can also increase inflammation throughout the body, making tissues more sensitive and less adaptable. This means that even small stressors can lead to bigger reactions than they normally would. Managing stress through practices like deep breathing, meditation, walking in nature, or simply setting aside time to unwind can lower cortisol levels, support hormonal balance, and improve the body's natural ability to stay comfortable. Nutrition is another crucial piece of the puzzle. A diet that's high in processed foods, sugar, and unhealthy fats can disrupt hormone balance, decrease circulation, and contribute to inflammation. Over time, these factors affect how the body feels and functions. On the other hand, a balanced diet rich in whole foods, like fruits, vegetables, lean proteins, healthy fats, and whole grains, nourishes the body at a cellular level. Proper nutrition supports hormone production, maintains tissue health, and helps stabilize mood and energy. Staying hydrated is equally important because dehydration can make tissues more sensitive and less resilient. Many people underestimate how much a simple shift toward more nutrient, dense foods and proper hydration can affect their comfort and vitality. Exercise plays a major role in maintaining healthy circulation and reducing tension. Regular physical activity helps keep blood flowing efficiently, delivering oxygen and nutrients to tissues while removing waste products. It also lowers stress levels and boosts mood by releasing endorphins, the body's natural feel good chemicals. Exercise doesn't have to mean intense workouts. Even light to moderate activities like walking, stretching, or yoga can make a meaningful difference. Consistency is more important than intensity. When the body is active, it stays flexible and adaptable, which helps reduce discomfort caused by tight muscles or restricted circulation. A sedentary lifestyle, on the other hand, can lead to stiffness, poor blood flow, and increased sensitivity, all of which contribute to physical discomfort. Sleep is another often overlooked factor that significantly affects overall health. During sleep, the body repairs tissues, regulates hormones, and restores energy. Without enough quality sleep, the body doesn't have the chance to fully recover, which can lead to increased sensitivity, lower pain tolerance, and hormonal imbalances. Over time, poor sleep can intensify feelings of discomfort and reduce resilience to stress. Establishing a consistent sleep schedule, creating a calming bedtime routine, and ensuring the sleep environment is comfortable and quiet can make a big difference. Even small improvements in sleep quality often lead to noticeable changes in how the body feels during the day. Another key element is emotional well-being. Emotions are not separate from physical sensations. They are deeply intertwined. When someone carries unprocessed emotions, anxiety, or mental strain, it often shows up in the body. Muscle tension, shallow breathing, and restlessness are physical manifestations of emotional stress. Over time, this tension can create discomfort in areas that are otherwise healthy. Taking time to process emotions, talk to trusted people, or engage in relaxing activities helps the body release stored tension and restore balance. A calm mind supports a comfortable body. The modern lifestyle often encourages speed, convenience, and constant productivity, but these habits can come at a cost. Eating quickly, skipping movement, staying up late, or constantly being on digital devices can disrupt the body's natural rhythms. Many people don't realize that their discomfort is often a reflection of how their daily habits interact with their physical systems. The body thrives on balance, routine, and mindful care. By slowly shifting habits toward healthier patterns, such as preparing nourishing meals, prioritizing daily movement, setting boundaries around technology use, and allowing time for rest, people often find that discomfort naturally decreases without needing complex interventions. An important part of lifestyle change is consistency. Many people try to make dramatic changes overnight, only to give up when the results aren't immediate. The body responds best to gradual, sustainable improvements that become part of daily life. Drinking more water, adding a short walk after meals, getting to bed 30 minutes earlier, or taking a few deep breaths during stressful moments may seem small, but these actions build on each other. Over weeks and months, they help regulate hormones, improve circulation, calm the nervous system, and support tissue health. This, in turn, reduces physical discomfort and enhances overall well-being. Every person's body responds differently to lifestyle changes, which is why self-awareness is key. Paying attention to how certain foods, habits, or activities make you feel provides valuable insight into what works best for you. For some, cutting back on processed foods and sugar brings noticeable changes. For others, prioritizing sleep or introducing regular movement makes the biggest difference. The goal isn't perfection, it's progress toward a more balanced and supportive lifestyle that allows the body to function optimally. Ultimately, lifestyle is the foundation of health. When stress is managed, nutrition is balanced, the body moves regularly, sleep is prioritized, and emotions are processed in healthy ways, the body operates more smoothly. Discomfort often lessens naturally because the systems that maintain balance are no longer overworked or neglected. Instead of looking for quick fixes, focusing on daily habits builds long term resilience and comfort. The connection between lifestyle and physical well being is powerful. And by taking responsibility for these areas, individuals can create meaningful, lasting change in how they feel every day. Early recognition, open communication, and medical guidance form a powerful combination when it comes to addressing discomfort and improving overall health. Too often, people wait until their symptoms become overwhelming before seeking help. But by paying attention to the early signs the body gives, many issues can be resolved more easily and with less stress. The body rarely stays silent when something is wrong. Whether it's mild discomfort, occasional pain, changes in sensitivity, or emotional unease, these signals are meant to be noticed and understood. When people ignore these messages, either out of fear, embarrassment, or a belief that the issue will go away on its own, the problem can grow more complex over time. Recognizing symptoms early doesn't mean overreacting to every small sensation. It means staying aware and respectful of the body's cues. This awareness builds confidence, encourages timely action, and often leads to better outcomes with less intervention. Open communication plays an equally important role. Many physical issues become harder to resolve simply because they are never talked about. Whether the conversation is with a partner or a healthcare professional, speaking openly allows others to understand what's happening and offer support. Within relationships, silence about discomfort can lead to misunderstandings. A partner may interpret withdrawal or hesitation as rejection, while the person experiencing discomfort may feel isolated, guilty, or misunderstood. These unspoken tensions build over time, often creating emotional distance. But when both individuals feel safe to express their experiences without judgment, solutions become easier to find together. Honest dialogue builds trust and removes unnecessary pressure. It also helps reduce anxiety because once something is spoken out loud, it becomes easier to address logically rather than carrying it silently as a private burden. Communication with healthcare providers is just as critical. Many people hesitate to bring up personal issues with doctors because they fear being dismissed, judged, or embarrassed. However, healthcare professionals are trained to deal with these matters respectfully and confidentially. What might feel awkward to talk about is, for them, a normal part of their work. The earlier these conversations happen, the more straightforward the solutions usually are. Mild discomfort can often be addressed with lifestyle adjustments, targeted treatments, or simple medical interventions. But when people wait too long, the condition can progress, requiring more complex treatments and causing greater emotional stress. Seeking professional advice early is not a sign of weakness. It is a sign of taking responsibility for one's well-being. Another advantage of early recognition and communication is that it allows for accurate diagnosis. Physical discomfort can have many different causes. Some are simple, while others may be more complex. By describing symptoms clearly and early, individuals give healthcare providers the information they need to identify the root cause accurately. This prevents unnecessary guessing or misdiagnosis and leads to faster relief. It also allows for the detection of underlying health issues that might not otherwise be noticed until they've progressed further. In this way, paying attention to the body and speaking up promptly can be a form of preventive care that protects long-term health. Beyond the medical benefits, early recognition and communication empower individuals emotionally. Many people live with discomfort silently because they've grown used to it, convincing themselves that it's normal or not worth addressing. This mindset can lead to a gradual erosion of confidence and quality of life. The moment someone acknowledges what they're feeling and takes steps to understand it, they shift from passively enduring to actively caring for themselves. This shift has a ripple effect, improving not only physical health, but also emotional stability and self-assurance. People often find that once they address one area of discomfort, their overall sense of control and well-being improves too. Medical guidance also offers reassurance. Sometimes, uncertainty can make discomfort feel worse than it actually is. Not knowing what's happening can lead to overthinking, worry, or self blame. A professional evaluation can bring clarity, even if the issue turns out to be minor. Having a clear understanding of the cause and the available solutions reduces anxiety and allows individuals to move forward confidently. In some cases, medical professionals may recommend simple lifestyle changes, while in others, they may suggest specific treatments. Either way, having professional input turns vague concerns into actionable plans, which is far more empowering than staying stuck in silence. Open communication is not limited to one-time conversations, it's an ongoing process. Bodies change over time due to age, stress, lifestyle, and various other factors. What feels comfortable today may feel different in a few years, and that's natural. Maintaining a habit of regular communication, whether with a partner or a doctor, ensures that small issues are addressed before they escalate. It also normalizes conversations about health, making them less intimidating and more practical. In relationships, regular check-ins foster emotional closeness and mutual understanding. In medical settings, routine discussions help track changes over time and allow for early interventions when necessary. A common barrier to open communication is fear of being judged, of appearing weak, or of facing an uncomfortable truth. But avoiding the topic doesn't remove the problem, it only prolongs it. Facing discomfort with honesty and seeking help shows strength, not vulnerability. It reflects a commitment to personal well-being and healthy relationships. When people embrace this mindset, they often discover that the conversations they feared are far less daunting than they imagined, and the support they receive is greater than they expected. Ultimately, early recognition, open communication, and medical guidance work together to create a proactive approach to health. Instead of waiting for discomfort to dictate the terms, individuals take the lead in understanding and addressing it. This approach builds resilience, improves quality of life, and strengthens relationships. Discomfort, when recognized and discussed early, becomes an opportunity for growth and healing rather than a lingering problem. It encourages people to listen to their bodies, trust their instincts, and engage with others and professionals in a way that leads to lasting improvement. By combining awareness, honest dialogue, and professional support, individuals can navigate challenges with confidence and maintain better physical and emotional well-being over time.